Good evening.
Good evening. Can I see your candidate number, please?
It's my candidate number.
399. Okay. You read the instruction outside, right?
Right.
Yeah, this is your patient. You can proceed.
Hello?
Hello?
My name is Muhammad. I'm one of the surgical doctor. May I confirm your name and age?
Hello, doctor. My name is Khalid and my age is 66-year-old.
Nice to meet you, Mr. Khalid. Today I will be your doctor. Is that all right?
Yeah, that's okay.
How can I help you today?
I've been experiencing this knee pain, doctor, for a long time, and it's getting worse and worse day after day. Please help me, solve this issue.
I'm really sorry to hear that, Mr. Khalid. Could you tell me why this pain exactly?
Yeah, it's in my left knee and my right knee, both of them, doctor.
When did you first notice this pain?
It has been there for a long time, doctor, 8 years. But in the last couple of months, it became unbearable.
Okay, yeah, it's getting worse, you mean?
Yeah, it's getting worse, yes.
Is it present all the day or during a specific time, Mr. Khalid?
It's not all the day. It's when I move, when I walk, when I do some exercise. It's not all the day.
Can see. Could you describe this pain for me?
It's a sharp pain. It's a sharp pain.
Does it move to any side, Mr. Khalid?
No, it's just in my knees.
I can see. Is there anything make this pain increase or decrease?
As I told you, when I'm moving, it does increase. When I'm resting, I feel better.
I can see. Let us score this pain, Mr. Khalid, from 1 to 10. 1 being the lowest pain and 10 being the highest. How you could score this pain?
Around 7, sometimes 10.
How about your health being recently, Mr. Khalid?
It's okay. There's nothing significant.
Did you notice any unintentional weight loss or general tiredness?
No.
Have you had trauma recently?
No, I don't have any trauma, no. You mean to my knees? No.
Have you had a fever?
No.
Okay, Mr. Khalid, did you notice any redness or swelling in your both knees?
There's no redness, but sometimes I feel they are a little bit swollen, yes.
Can see. Did you experience that your knee giving away while walking?
No.
Did you experience locking of your knee, Mr. Khalid?
No.
Okay. Is there any back pain?
I have back pain from time to time, but it's not like the main issue for me right now.
Any lower limb weakness or numbness, Mr. Khalid?
No.
Did you experience any redness, painful eye, or change in your color of the skin?
No.
Any bowel change?
No.
Can see. Okay, Mr. Khalid, do you have any other medical condition?
Yes, doctor, I have hypertension.
When you diagnosed by this hypertension?
6 years ago.
What type of medication that you take for this hypertension, Mr. Khalid?
I take lisinopril, doctor.
Is there anyone of your family has a similar condition?
No one I'm aware of.
Regarding to your medication, Mr. Khalid, do you have any regular medication?
Just the lisinopril.
Any allergy?
No, I don't have no allergy.
Now, Mr. Khalid, I want to ask you a personal question.
Yeah, that's okay, doctor.
Okay, Mr. Khalid, what do you do for a living?
I'm a car dealer.
Who live with you?
My wife and my youngest daughter.
Do you smoke, Mr. Khalid?
No, I don't.
Do you drink alcohol, Mr. Khalid?
No, I don't.
Okay, Mr. Khalid, what do you think the causes?
I'm not sure, doctor, but I think this I've been diagnosed with a knee condition years ago. I think it's the same issue.
What's the most concern about?
Being immobilized. I'm afraid this pain will prevent me from moving normally.
Don't worry, Mr. Khalid, we will take care of you.
Okay, hope so.
What is your expectation from us?
Relieve the pain, basically.
Okay. Mr. Khalid, did you experience any chest pain or shortness of breath?
No.
Any difficulty in urination or tummy pain?
No.
Okay. Okay, Mr. Khalid, I reached to our end of my questions. You have been so cooperative. Thank you so much.
Thank you. Can you present your patient, please?
I took clinical history from this gentleman, 67 years old, presented with knee pain in both knees 7 years ago, and it's getting worse. That's why he came to the hospital. The pain is sharp in nature, not moved to any side, increased by walking, and relieved by rest. There is no symptom suggestive of bone tumor or inflammatory bowel disease or a spine problem.
Okay. From what you're saying now, what's your most appropriate diagnosis?
My main diagnosis is osteoarthritis.
Okay. And what's your differential diagnosis?
Also, I will consider septic arthritis, rheumatoid arthritis, bone tumor,
Okay.
and
Bone tumor.
meniscal injury.
Okay. But there's no history of trauma, right?
Yes.
Okay. How will you investigate this patient?
First, I will request and weight-bearing X-ray for knee, for
Okay.
both knees, and also I will request CT and MRI for the knees.
Okay.
Then I will consider a blood investigation as full blood count, estimate hemoglobin and white blood cell. Also, I will consider and take sample by arthroscopy for cultural sensitivity.
Cultural sensitivity. If you are suspecting septic arthritis, right? If this
Yes.
patient has osteoarthritis, what will you see in the X-ray?
Okay. I can see narrow joint space.
Okay.
And subcondylar sclerosis.
Okay.
And osteophyte formation.
All right. And how will you treat your patient?
I will consider conservative management and surgical management. Conservative management, give the patient analgesia for the pain. Advise the patient to keep or maintain a healthy weight, good exercise, and physiotherapy. Also, I will consider an heat application and intra-articular steroid injection. The surgical option.
Intra-articular steroid injection. This is the medical treatment, not conservative, right?
Right.
Okay. What else? What about the surgical?
The surgical option include arthroscopy and arthrocentesis. Also, real. Okay.
What else?
Total all or partial knee replacement and realignment osteotomy.
All right. Okay, that's all. You can go to the next station now.
Thank you so much.